Yep.
Hey, Alan, you cut out there, but Charles and I will be presenting, so I'm happy to get started if you think we have the majority of applicants, or we can wait another minute or so if needed.
Because this is an open forum, we don't actually know how many folks will be joining us today. So far, we've got 75 people on the call.
Okay, well, for the sake of time, I'm happy to get underway now. So thank you, everybody. Sorry, let me just make sure I can see the screen here. Thank you for the invitation for us to speak at this meeting. Sean and I will be talking about the transition from the Health Information Privacy Committee to the Provincial Health Research Privacy Committee and the work that we've been doing over the past month or so. So we'll start with some introductions. My name is Jason Berry. I'm the Acting Director of Information Governance with Manitoba Health. Our area was responsible for providing the administrative support to the Health Information Privacy Committee. However, that's the administrative support for the Provincial Health Research Privacy Committee is in the process of being transitioned to Research Manitoba. Saila, did you want to start? Introduce yourself, sorry.
Oh, I am the previous Health Information Privacy Coordinator, and now my role is Information Management Analyst. I'm working with Information Governance Unit in Manitoba Health.
Thanks, Saila. So I'm not sure who's running the slideshow. I think it's you, Saila. So I'll just let you know.
Yes.
Yeah, so I'll tell you when to switch slides for me. So
Okay.
Perfect, thank you. So the objective for today is to outline changes and provide an update to the process of requesting access to personal health information maintained by Manitoba Health for research purposes, and includes the discussion around the transition of roles from HIPC to Ferpc. So we will be talking about some of the processes for requirements to get approval from Ferpc. Some of this information may be applied generally across the system, but we are speaking specifically as Manitoba Health in our roles for Manitoba Health. Next slide. So most of you should be aware of the research improvement through harmonization in Manitoba, the Rhythm Plan program that's being carried out by Research Manitoba. It has been launched in a transitional phase in order to comply with the changes to FIA and to allow time for some necessary changes to policies and procedures within stakeholder organizations. For this interim period, temporary changes will be minimized in order to reduce any burden on researchers until the full Rhythm program is able to be implemented, which will include the Provincial Research Administration System. This system will have a single online form that can be used for privacy, impact, and ethics submissions. So until the PROS system is operational, research projects that require Ferpc approval will need to use the application form, which is found on the HIPC Ferpc website. Next slide. So as I previously mentioned, Charles and I have been working with Research Manitoba to transition the administrative support for the new Ferpc. So just a few quick updates of what we've been working on over the past month. So ministerial appointments and orientation sessions have been completed for Ferpc members in January, and the first Ferpc meeting was held last Friday on February 4th, 2022. The HIPC website has been updated to include information about Ferpc as of January 1st. And of course, it includes a French translation. We're also currently providing support to Research Manitoba when necessary to support the application submission process and meeting facilitations for Ferpc. And of course, we're also underway to transfer old HIPC files to Research Manitoba. This, of course, we'll get into a little bit later, but amendments for previously approved projects from HIPC will need to be submitted to Ferpc. So there is a requirement for the Ferpc to be able to access some of those old HIPC files. Next slide. So we talked about the legislation, so I just want to give you a quick update around what actually changed and what is actually important for this process. So Section 24 of the Personal Health Information Act is what we want to look at, and it states that a trustee may disclose personal health information to a person conducting health research if the research has been approved under this section. 24.2 states that an approval may be given by the committee established under Section 59. And then Section 59 states that the minister must establish a committee in accordance with the regulations for the purpose of approving health research projects under Section 24. So it's a little bit of a map to get all of the information, but what is important here is 24.2. This used to state that approval may be given by the Health Information Privacy Committee when the personal health information was maintained by a government or government agency, or an institutional research review committee when it was maintained by a different trustee. So we removed both the Health Information Privacy Committee and institutional research review committees so that all research projects requiring personal health information under Section 24 must go through Ferpc. I think there's, because of the previous way the language was, there's over 20 plus institutional research review committees across the province. And depending on what the research was trying to access, you were submitting to quite a number of those review committees for review. So this process is meant to reduce that burden to ensure that all projects go through one review panel under Section 24. And of course, that is the Ferpc. Next slide, please. So as I mentioned, the research or the Personal Health Information Regulation actually establishes the Health Research Privacy Committee. It identifies what information it needs to be included when submitting to the Ferpc. It also identifies the membership of the Ferpc as well as how they can operate their meetings. But the key change I wanted to identify here is how it relates to the Rhythm Initiative. So on receiving the information required under subsection 1, the Health Research Privacy Committee must ensure that the information is forwarded to Research Manitoba for consideration by CHIPR. Now, after receiving satisfactory confirmation that the proposed research project has been approved by CHIPR, the Health Research Privacy Committee may grant or refuse to grant an approval of the project and must advise the research applicant in writing of this decision. So what this means for the transition period is that CHIPR is responsible for ensuring that research ethics boards have approved a research project prior to Ferpc decisions. What this means once everything is fully implemented is that we can use that one single online application for Ferpc submissions as well as for CHIPR submissions, and CHIPR will be responsible for the ethics review. So this is that link for Ferpc into the Rhythm program, as it requires any projects submitted to Ferpc go through the same process and be reviewed by CHIPR as well. Next slide. So what projects require Ferpc review? So this information is available on the Research Manitoba website. I thought I'd go through a few of the points here and discuss how it relates to accessing Manitoba Health information. So Ferpc review is required for research studies that request or require the use or disclosure of fee that is maintained by government or government agency, where authorization for use was previously determined by the HIPC, where the fee is maintained by any trustee, where there'll be no contact with the individuals that may be participating in the study and no plan to get consent from those individuals. Research studies where the fee is maintained by a trustee to identify eligibility and or contact patients to discuss participation in a study where those patients have not previously provided consent to be contacted for research purposes. For research studies that require the disclosure of fee, where they will be required to link that data from multiple trustees, or where the research studies involve the collection or use of FINs by the researcher. So when it comes to Manitoba Health, obviously the first point really identifies that any requests from a researcher to Manitoba Health will need to go to Ferpc because we are a government department. Next slide, please. So most of you should be aware that we do have a requirement that in order to access personal health information maintained by Manitoba Health, you will need to go through the Manitoba Center for Health Policy. As mentioned in the previous slide, approval from the Ferpc is required before the Manitoba Centre for Health Policy will grant access to this information. So as I said previously, additional information about when Ferpc review is required can be found on the Rhythm website. We've created the link here. And I will mention that we are making this presentation available after the presentation. So you should be able to access those links if you open up the presentation. Next slide. So the next few slides, we are just going to kind of try to clarify when a researcher or research coordinator should be contacting the Health Information Privacy Committee, the Ferpc, or Manitoba Health. So previously, when Manitoba Health provided administrative support to the Health Information Privacy Committee, we were able to utilize the HIPC inbox for essentially anything that involved research, whether it was for the HIPC or whether it was for Manitoba Health. This inbox will be discontinued as of January 1st, 2023. So we do want to start moving anything under the responsibility of Manitoba Health to our own inbox, which is pima@gov.mb.ca. We will publicize this inbox more over the coming weeks. But this will include any correspondence around research agreements, publications, or general inquiries around how to use Manitoba Health data. And we'll get into that in the coming slides. Next slide, please. So let's start with when to contact the Health Information Privacy Committee. So the legislation that amended the Personal Health Information Act included a clause that stated a review of a research proposal that was commenced by the Health Information Privacy Committee or an institutional research review committee, but not completed before coming into force of this act, is to be concluded as though this act has not come into force. So essentially what that means is that the HIPC will continue to review projects that receive conditional approval before January 1st, 2022. Applicants will have 1 year from the date of the conditional approval, which is on the letter, to submit any requested documentation to the HIPC for a final review and approval. Once this 1 year period expires, researchers will need to submit a new application to Ferpc. So as a quick example, if HIPC provided a conditional approval letter to a research project in June of 2021, that project or that researcher has until June 2022 to submit any requested documents for the HIPC to do a final review and approval. Next slide. And Saila, I believe this is where you're going to take it away.
Yeah, thanks, Jason. So next few slides, we are going to talk about when to contact Ferpc, when to contact HIPC, and when to contact Manitoba Health. So this one is actually provide you the information when to contact Ferpc. So any new research application requesting access to personal health information maintained by Manitoba Health for research purposes require Provincial Health Research Privacy Committee approval, and all the application form is found in the HIPC Ferpc website. And HIPC Ferpc uses the existing application form with some minor change in it. All applications should be submitted to Ferpc inbox in a GIF formatted once Provincial Research Administrator System launch later in 2022. All Manitoba Privacy and Impact Review application amendment will be done.
Saila, sorry to jump in. I think you're cutting out quite a bit.
I'm cutting out.
Yeah, you seem better now.
Okay, sorry. Okay. The next one is like any proposed changes to research project that was approved by HIPC or Ferpc must be reported to Ferpc for review and approval in advance to its implementation. Researcher will need to complete the protocol amendment form, email once signed a copy to the Rhythm coordinator, and send the protocol amendment form to the Ferpc inbox. The protocol amendment form is also available in the HIPC Ferpc website, and HIPC Ferpc number should be quoted on the form. Organization responsible for housing data should be copied on the submission. For amendment to the project that are carried out in MCHP and MCHP access team should be included in the email that receive approval before accessing the information. Research agreement needs to be in place. So any correspondence related to research agreement with Manitoba Health, we're implementing the new workflow management software, and we are hoping to use PHRPC inbox to receive the request and assigning the work to the team by the inbox. Jason, do you need to want to talk anything about the agreement, please?
Sure. Maybe I'll just state that this is where we really want to identify a difference in the responsibilities of the HIPC and the responsibilities of a trustee, as well as the Ferpc, I guess, going forward. So section 24 identifies that an approval under this section is conditional on the person proposing the research to enter into an agreement with the trustee in accordance with the regulations, where the person agrees to the items identified below. So the research agreement is the responsibility of the trustee. So going forward, any correspondence for any research agreements with Manitoba Health should be sent to the PHRPC inbox. Go ahead, Saila.
Okay, thanks, Jason. So any correspondence related to the publication, presentation, report that use Manitoba Health data should be submitted to PHRPC inbox for review, and the timeline is same as before. At least 30 days for publications, journals, and thesis presentation, and 10 days.
Saila, sorry, you're cutting out again.
That is distributed and posted on the website. Oh, so should I repeat that again, Jason?
Sometimes it helps to turn your camera off.
Oh.
Mm-hmm. And I think you want to move to the next slide as well. Thanks for that advice. I might do that as well.
Okay. So, any publication, presentation, or report should be sent to the Manitoba PHRPC inbox, and the timeline is at her 30 days for the publications and 10 days for the presentations and other abstracts. So Manitoba Health will review the publication, presentations, and report to ensure the confidentiality of the information that was accessed and maintained and prior to the presentations. So this slide actually gives us in a nutshell where to go for what purposes. So HIPC website, as Jason mentioned, HIPC inbox will review research project that receive conditional approval by the HIPC and are submitting all the documents for full approval, whereas the Ferpc inbox will get all the new application, protocol amendment, and question related to information, submission information and requirement. And PHRPC inbox is actually, we are going to use for corresponding the research agreement extension and with Manitoba Health, submission for publications and general queries related to Manitoba Health data. So talk about some questions from my, thanks to all of you who have provided the questions, and that actually give us guidance to facilitate the presentation. So one of the question was like, can all submission from new and old include an option of digital signature? So digital signatures are acceptable for both amendment and new application, and it can be done using Adobe Acrobat. Additional option for supporting the digital signature will not be made in near future for the forms, as these forms are actually temporary basis. until the PARS is operational. Another questions were like any changes in the research agreement submission process, including the extension. As mentioned before, there are no changes in the existing research agreement and extension process with Manitoba Health, and all correspondence should go to PIMA inbox. Their question about like the current HIPC form and amendment form look like the HIPC, previous HIPC form. Any changes in future, either the content or format. HIPC forms and amendment form were based, Ferpc form and amendment forms were based on the HIPC form with a few minor change until the PARS is in place later in 2022. There are some changes in there, like proof of submission, proof of trustee approval is no longer required for Ferpc submission. However, trustee approval is still required, and a research agreement needs to be placed before accessing any information. Proof of supporting letter from First Nation, Métis, Inuit institutions or communities is still required for research where there is a focus on interest or intent to stratify the analysis or outcome by First Nation, Métis, and Inuit populations. Without that, full approval will not be granted. So another questions actually were posed from if any research project received conditional approval from HIPC in, for example, 2010. I think Jason already mentioned that, but we want to mention that in details here. Not all the conditions have been met yet. Do they need to resubmit submit to Ferpc? This is a very important question. So conditional approval by HIPC is only valid for 1 year. If 1 year has passed and the research team will not need to submit a new application to Ferpc and if REB and other approvals have been received, these approvals remain in effect, and it will be submitting again with the Ferpc applications. In this case, it is recommended to notify rhythm coordinator as a resubmission and provide a conditional approval, HIPC coordination, conditional approval with the application. So I think that's it. Thanks to all of you for attending the session, and we now welcome all the questions from you.
Thanks, Saila. So yeah, I'm not quite sure how you guys usually handle question and answer periods. So Eva, if there's any specific processes in place, otherwise we'll just ask questions as as someone wants to speak up.
So I'm going to suggest that people, as Charles has done, use the hand at the bottom of the under reactions. Shayla, if you stop sharing your screen, we'll be able to see everybody, which will be useful. Use the hand under the reactions, and you'll come to the top of the screen, and we can take the questions one at a time.
Thank you.
Charles' iPhone. Yep.
Go ahead, Charles.
Yeah, so guys, just to make this simple, and I'm a big user of HIPC, as you know, basically, for every new application that I would otherwise go to HIPC, I'm just going to go to what you're calling Ferpc. So for me, it's just getting into my mind that it's this new committee rather than HIPC. It'll have a new application form with that. With that logo, etc., and I'll go to them. So the first question is, will the application form really be quite the same, or will it be materially different? That's the first question. The second thing is, for any outstanding, manuscripts to follow up, to submit in terms of the work that we've already done, just to be clear, in the next year, are we sending them still to the old HIPC, or are we transitioning everything to send everything that we've got now to Ferpc? So 2 questions.
Thanks, Charles. So to answer your first question, the Ferpc application form is essentially the same as the HIPC application form. We've modified a few questions, but nothing major. So it should be quite familiar to anybody who's ever filled out a HIPC application form. Of course, once you have the form completed, it should be submitted to Ferpc, the Ferpc at research.mb.ca. With regards to your second question, the PIMA inbox is operational now, and we would like to start utilizing that inbox as soon as possible, just so that people start becoming comfortable with using it. The HIPC inbox, we will still be monitoring that for a year. So when people if people still submit publications to that inbox, which I'm sure will happen, we will still get access to it, but we most likely provide a reminder to say, please start sending this to PIMA. So you can basically use the PIMA inbox starting today.
Okay, great. Thank you. And just one last thing, if I may. So I don't know if you mean for the Ferpc to help encompass this, but within, for instance, either shared health or the WHA, there are times that I may want to do studies through different hospitals. Are you saying that with this application, we won't need to apply directly to shared health and or the other hospitals to get their approval for certain studies? It's an REB application, a Ferpc application, and if we are needing MCHP, then an MCHP application. But we can cut out these applications to the different hospitals and shared health.
So for the transitional period, you still may need to submit to some of the impact review committees by the trustees. So the Ferpc approval is required before a trustee is able to disclose personal health information for research purposes, but a trustee is still responsible for approving that disclosure on their end as well. So while Ferpc approval is required, unless the trustee also approves it, that disclosure can't happen. So a trustee still needs to review any requests for access to their information. So you still would need to reach out to the other trustees like shared health or the WHA or the regions, just to make sure that you follow the appropriate process for getting their approval as well.
So effectively,
Jason, sorry,
can I
interrupt here, Charles? Jason, I think what you've described is accurate for the interim period, but the whole point of Rhythm is that we will complete one on-site, one electronic application for everything, for HREB, for Ferpc, and for all trustees should be on the same site with one application. That's the press, which is that's not yet operational. That's currently in testing, but that's the intent. So we're now in a transitional phase where all that's happened is that HIPC has transferred to Ferpc. The rest is pretty much the same, but the final state will be a single application with no forms. Well, it'll be one form online, and that will include all trustees.
Wonderful. Sounds good.
Yes,
Thank
that
you.
was thank you, Ellen. That was very well put. So yeah, today we were just talking specifically around the transition phase. You know, the intention is to have a single application for all reviews for impact, privacy, and ethics once the PROS system is up and operational.
There were a couple of questions in the chat. One was about where the presentation today will be housed when it's shared. I don't know what the answer to that is.
Yeah, I think we talked with Eva before the meeting. So I believe she has a distribution list. So it could just be sent through email unless you guys have a place that you can post it on your website.
Okay, so we'll look after that and we'll let everybody know where it is. And then there's a question from Sharif for publications, reports, reviews. Should we send to PIMA email now or not yet active? And I think you've already answered that. The PIMA review, the PIMA website is, email is currently open for those to receive those.
Yeah, that is correct.
Okay. I don't see any other hands up, so I'm going to ask a question. There are other data sources such as MapCRN, which is EMR data, which is currently does not require HIPC approval, but according to the legislation as it's written, it does require Ferpc approval. So can you just describe a little bit more how that's going to be different? Where does the MapCRN itself approval come in, and the Ferpc approval come in?
So that's a good question. So with regards to MapCRN, this is something that a trustee would be responsible for ensuring that the proper approvals are in place. So basically, where disclosure is occurring under Section 24 for any trustee, Ferpc approval is required. Now, that may add additional work for some trustees where HIPC wasn't required in the past. So they will have to apply it to Ferpc now. But again, this is just until the prize system is online, which will happen later this year. We did create a specific document that's on the Research Manitoba website that kind of explains when a researcher or it can be used by researchers and trustees to confirm when Ferpc review is required. So essentially, if a researcher does not have consent to access or consent from the individuals that the information is about to access that information for their research, it will need to go to Ferpc for review. So the scoping document does go into a little more detail about that, so I do recommend taking a look at it. Sorry, does that answer your question?
Yeah, thanks, Jason. That it does. I mean, I guess MapCRN still remains the trustee, but they need Ferpc approval before they can release it. And there's another question about who a trustee is, and that's we can go back to it in a moment, but I'll ask you to address that, but I just want to first draw attention to the chat where Wanda Phillips-Beck has reminded us that there still is a separate application to HIPC for First Nations data and research file access. There have been conversations between the Rhythm Group and HIPC about including them in that process at some stage. That has not been achieved as yet, for good reason with regard to OCAP. So just if anybody is intending to access First Nations data or accessing data through MCHP and focusing on First Nations, you still need to go through HIPC as before. That has not changed at all. So Jason, the definition of a trustee.
Yeah, that's a really good question. So trustee, it's defined in the legislation, and I might actually just open the legislation because it would be helpful to read the official definition, and then I'll try and explain it in more layman terms. So under FIA, a trustee means a health professional, healthcare facility, public body, or health service agency that collects or maintains personal health information. So for example, a hospital is a trustee, the regions are trustees, the University of Manitoba is a trustee, so is Manitoba Health. And this allows them to collect personal health information for purposes that are authorized within FIA. So, the examples in the comments, a random researcher is not a trustee, a family member is not a trustee. They will be accessing information that's maintained by a trustee in some cases, or they will have to seek to get consent from the individuals that the information is about to access that information, but they themselves would not be considered trustees.
Yeah, you've clarified that nicely. I will say though that there are clinical researchers who have created databases that they may think they are trustees for and may think they can get permission for use of. But according to the legislation, that the trustee there is actually shared health or the region.
Yes, that is correct. So an individual employee working for shared health is not considered a trustee, but they do work for a trustee. So you're absolutely right. A clinical, if they've created a clinical registry, they would not be the person maintaining that information. It's actually the trustee shared health who's responsible for ensuring that information is maintained in accordance with FIA.
So there's a question now about, do we need to submit non-health data providers approvals? And it just disappeared, moved up on my screen. And HIPC or MMF or MIA approvals to FRPC to get final approval. So that's a yeah. So there are these other organizations that we do need approval from so either non-health providers or the Indigenous community providers. Do those have to go from there to FRPC?
So what we've done for FERPC is, so HIPC, MMF, MIA, all those approvals need to be in place prior to FERPC approval. When you talk about non-health data providers, well, with regards to non-health data or even health data, trustee approval is required before they can give you access to that information. But the one change for FERPC is that they don't require to see that approval before they give their approval. So essentially what that means is that you can get a FERPC approval and you can take that approval to the trustee and say, here's the approval, can you please provide your approval now? And then they will be responsible for creating a research agreement before giving access to that information. So it's the same with non-health data providers. I'm assuming that's probably more specific to departments like justice or education that provided information to the MCHP. So no, the FERPC does not need to see their approvals, but they are still required before you can access the information. So hopefully that makes sense.
Yeah, thank you. So I think Julianne has raised the point that if NISM or MIA or MMF don't want information accessed, well, then it can't be, because FRPC does say that those groups need to provide approval. So that's still clear. And the other one is that the MAPCRIN approvals comes into effect from January 1. Studies that were pre-approved before that do not need that new approval. That's correct?
That's correct. So any approvals that were received before January 1st, they are still in effect now.
And I think you've answered Marriott's question as well, that those permissions are still required. Wanda has another comment. Wanda, do you want to take yourself off mute?
Yeah, can you hear me?
Yes, we can hear you fine.
Okay, my Zoom audio was not working this morning. I just wanted to add, to the point where the researchers may be planning on stratifying by First Nation, Inuit, or Métis. There are just some research questions that you may anticipate that you will be having a higher proportion of that population in your sample. So I just want to maybe recommend that you add that point on your information site or wherever it is that you're putting this information, because research questions, if you're going to be looking at child and family services data, for instance, or looking at TB data, you might run into a higher proportion of First Nation, Inuit, or Métis.
Yeah, that's a very good point, Wanda. Thank you for bringing that up. I do know that, in the past, when that is the case, we do ensure that the proper institutions do review it. I know the MCHP has similar processes in place, but yes, we definitely want to make that as clear as possible. So we'll take that back with us to make sure that we can make that on our websites.
This has been very helpful, Jason and Shayla. You've really given us a very clear understanding, I think, where to go for what. And you haven't told us why, but that's okay. That's not your job. And I think Charles Church Bernstein's comment really highlighted the point about why all this is happening, is that so that we can have a single process moving forward. we just aren't there yet, and hopefully we'll be there soon once the press is in place.
Yeah, absolutely. We're looking forward to that more than anybody, I think. So it will definitely make things easier on our side. So, if there's no other questions, we really appreciate the chance to talk with you all. Hopefully it does clarify who you should be going to and when. And if there are any additional questions around this presentation, or if you guys require additional clarity, feel free to reach out to us. You can use the PMA inbox, or I think a lot of you might already have Shaila's and my emails as well. So feel free to reach out to us with any questions.
Before we go, are there any other comments? I see that Paul Baudouin's here. Any others who've been involved in this process who want to make some comments?
Hi, thanks, Alan. Yeah, I'll just make a few comments. Thanks, Jason and Shaila. That was really good. I think the more that we have these kinds of conversations and we talk about it, the more it will start to make sense, even in the interim, as we're leading towards the main objective, the goal. And it really is to make things easier. Less work on the researchers, more coordinated between all of the trustees and the organizations that participate in research, with the ultimate goal of really allowing, I think from a health system perspective, more sites, regions, etc., to participate in things with less work involved from everybody's perspective. That's really the end goal. So this is really good information. I appreciate that. It is going to be a little bit bumpy in the transition because we've had some legislative changes that we have to work through, even though the electronic system is not quite ready yet, but it's getting close, so it's going to be good.
Thanks, Paul. It's been a long road, but I think we're on the right track, it seems to be. So thanks again, Jason and Shaila and others for all your questions and comments. I think we've all learned a lot today, and all for the good of making sure that we can do good research together and advance the health of the population in a meaningful way. Okay, thanks everyone.
Thank
you.
you.